If you're over 60, there's a 70% chance your penis is already aging faster than the rest of your body, and no one's told you. That's not a scare tactic. That's a clinical truth, and ignoring it could cost you more than your sex life. It could quietly affect your heart, your bladder, even your confidence. I'm Dr. Mohit Kara, a men's health specialist with over 30 years of experience helping older men reclaim strength, function, and dignity through science-backed care. Most men think penis care is about pills or performance, but the real secret? Daily habits, simple, specific steps that 99% of men never hear about. In this guide, I'll walk you through the 4 essential things every man should do to protect his sexual and urinary health after 60, starting today. And number 3, it's something almost no one talks about, but it can change everything if you've been struggling in silence. Before we begin, if you care about staying strong, confident, and healthy as you age, make sure to hit subscribe and tap the bell icon. I share real advice just for men over 60, based on what I see every day in my clinic. And if this message speaks to you, drop a 1 in the comments. If not, feel free to type 0. I want to keep improving and serve you better. Now, let's get into the first, and perhaps most important, pillar of penis health after 60, blood flow. Because without strong circulation, nothing else works. This is where everything begins, and where most men start losing ground without even realizing it. Essential 1. Protect blood flow, your lifeline to function. As men age, one of the first silent threats to their sexual health is reduced blood flow. Most men don't notice it at first. There's no pain, no obvious signal, just a slow, quiet decline in firmness, sensation, and endurance. And by the time it becomes obvious, years of damage may already be in place. Here's why this matters. Your penis is a vascular organ. That means it depends almost entirely on healthy, flexible arteries to do its job. When those arteries harden, whether from aging, high blood pressure, diabetes, or inactivity, your erections suffer. Not only that, but your entire pelvic region begins to weaken due to poor oxygenation. The tissue becomes less responsive, the nerves lose sensitivity, and the body stops prioritizing function in that area altogether. But it's not all bad news. The truth is, improving blood flow is one of the most effective and rewarding ways to care for your penis after 60, and it's absolutely within your control. It starts with movement. Daily walking, even just 30 minutes, stimulates circulation, improves endothelial health, and helps keep your arteries clear. Pair that with a diet rich in leafy greens, berries, and healthy fats, and you're giving your body the natural tools it needs to generate more nitric oxide, the molecule responsible for relaxing blood vessels and enhancing blood flow. You can also add simple self-care practices like warm showers and gentle massage to the area. These aren't just about comfort, they're about stimulating local blood supply and nourishing tissue. Every small increase in circulation helps your body remember that this area still matters, that it's still alive and still in use. I've seen men in their 60s and 70s improve their erections dramatically by doing nothing more than taking blood flow seriously. No pills, no procedures, just deliberate attention to a part of the body that was too often ignored. And when circulation improves, men don't just feel more confident in the bedroom. They often report better urinary control, fewer nighttime trips to the bathroom, and an overall boost in their energy and self-esteem. If you're going to start anywhere, start here. Blood flow is the foundation of function. It affects everything downstream, literally. But protecting your circulation is only the beginning. The next habit is something men often overlook, yet it plays a quiet but critical role in your long-term comfort and confidence. Let's talk about a part of penis care that's as simple as soap and water, but just as essential. If you're still here and finding this valuable, type the number 1 in the comments to let me know you're following along. Now, let's move on to the next essential step. Essential 2. Hygiene and skincare, the quiet guardian of comfort. Penis care isn't just about performance, it's also about protection, protecting the skin, the tissue, and the sensitive structures that keep you comfortable, clean, and confident. After the age of 60, the skin around the genital area becomes thinner, drier, and more vulnerable to irritation and infection. What used to be a quick rinse in the shower is no longer enough, and neglecting basic hygiene can lead to consequences that range from discomfort to serious medical issues. Good hygiene helps prevent a host of avoidable problems. Without proper cleaning, bacteria and fungus can accumulate in the folds of the skin, especially under the foreskin if you're uncircumcised. This can lead to inflammation, itching, foul odor, and even painful infections like balanitis. For some men, the irritation becomes so chronic they develop phimosis, where the foreskin tightens and becomes difficult or impossible to retract. Others may ignore small changes in the skin, redness, spots, ulcers, thinking it's nothing, when in fact these could be early signs of something more serious like penile cancer or dermatological conditions requiring treatment. But the good news is that this kind of care is simple and doesn't require fancy products or complicated routines. A daily wash with warm water and a mild, fragrance-free soap is usually enough to remove buildup without stripping away the natural oils that protect your skin. After washing, it's important to gently and thoroughly dry the area. Moisture trapped in folds of skin becomes a breeding ground for fungal infections, especially in warmer climates or under tighter clothing. What's more, regular skin care isn't just about cleanliness, it's about awareness. When you care for this part of your body each day, you stay in tune with it. You'll notice if something feels different, looks unusual, or just seems off. That awareness can lead to earlier doctor visits, faster treatments, and better outcomes. I often tell my patients, respect in, respect out. The care you give this part of your body reflects how much you value your health, your comfort, and your identity as a man. Hygiene isn't optional after 60, it's essential, not just for health, but for dignity. But even with clean skin and strong circulation, there's one key area most men still ignore until problems begin to show. It's not visible in the mirror, but it controls everything from erections to urination. And when you learn how to strengthen it, you unlock a whole new level of control. Let's take a look. Essential 3. Pelvic floor strength, the hidden engine of urinary and sexual health. Most men over 60 have never even heard of their pelvic floor, let alone considered training it. But this hidden network of muscles is one of the most important and most overlooked parts of maintaining a healthy penis. The pelvic floor sits beneath your bladder and supports the organs of your lower body, including your prostate, rectum, and penis. And when these muscles are strong and activated, they directly improve erectile strength, ejaculation control, and urinary function. As we age, these muscles naturally weaken. That weakening shows up in small but frustrating ways. More frequent bathroom visits, occasional dribbling, or feeling like you didn't fully empty your bladder. In the bedroom, you might notice erections that don't last as long, or orgasms that feel weaker than they used to. But here's the key. These aren't just signs of aging, they're often signs of a pelvic floor that's been ignored for too long. The good news is that these muscles can be trained, just like any other part of your body. With regular pelvic floor exercises, also known as Kegels, men can strengthen the muscles that control blood flow into the penis and prevent blood from leaking back out during an erection. Over time, this means firmer, longer-lasting erections without medication. And since these same muscles are involved in ejaculation, improved control can also help men reduce premature climax or increase intensity. From a urological perspective, a stronger pelvic floor also means better urinary control, less leakage, more complete emptying, and fewer nighttime trips to the bathroom. These exercises require no equipment, no special training, and can be done quietly, anytime, while sitting, standing, or even lying in bed. The movement is subtle, but the benefits are profound. I've seen men go from frustrating symptoms to full control in just a matter of weeks. Not because they did anything extreme, but because they finally took control of a part of their body no one had ever taught them to pay attention to. Think of your pelvic floor as the engine room of your sexual and urinary system. You can't see it, but when it's strong, everything works better, and when it's weak, things begin to fall apart. Don't wait for discomfort to become dysfunction. Now, if strengthening invisible muscles can have this much impact, imagine what happens when we address the one area most men fear to talk about, the emotional side of sexual health. That's where everything ties together, and where the greatest healing often begins. If you're still with me and these insights are resonating, go ahead and type the number 1 in the comments, just to let me know you're here and engaged. Now, let's keep going with essential number 4. Essential 4. Open, ongoing intimacy. Mental health is physical health. When we talk about penis care after 60, the conversation often centers around physical function, blood flow, hormones, muscle tone. But there's one element that's just as critical and often overlooked: emotional connection. As men get older, intimacy can become more complex. Changes in performance, body image, or even past medical conditions can make you feel distant from your partner or withdrawn from the idea of sex altogether. But here's the truth: your mental and emotional health directly impacts your physical sexual function. Ignoring that link is like fixing the engine of a car, but never touching the ignition. The penis is not isolated from the rest of your life. It's a highly responsive organ, and its function is deeply tied to your sense of self, your relationships, and your state of mind. Anxiety, fear of failure, or emotional distance from your partner can all trigger a cascade of physiological responses: tension, poor blood flow, low libido, that impact your erections and sensitivity. And the longer these emotional stresses go unspoken, the more disconnected you can become from your own body. That's why cultivating intimacy, real, honest, non-performance-based intimacy, is essential. Sometimes the first step is simply talking. Sharing your worries, fears, or hopes with your partner creates a safe space for emotional closeness, and that alone can restore a sense of connection that reignites physical desire. Other times, it's about redefining what intimacy means. It's not just about penetration or climax, but about shared touch, laughter, eye contact, and affection. And if you've been struggling for a while, speaking to a therapist or counselor who understands male sexuality can make a world of difference. There is no shame in asking for support, only strength. When emotional health is prioritized, many men find that physical function improves naturally. Erections return, desire increases, confidence builds. Not because of a pill, but because the mind and body are no longer at odds. This is the kind of care that honors the whole person, not just one part of the anatomy. When we approach sexual health this way, it becomes less about fixing something broken and more about nurturing something worth preserving. And once that shift happens, everything becomes easier. Now, if these 4 essentials are the foundation, the next step is what ties them all together. There are small, daily actions, practical, easy-to-apply habits that can reinforce everything you've just learned. Let's explore the bonus strategies that can take your results to the next level. Bonus daily tips for men over 60. Sometimes, the biggest improvements come from the smallest habits. While the 4 essentials we've covered lay the groundwork for long-term penile health, there are a handful of daily practices that act like glue, holding everything together, reinforcing progress, and helping you maintain results well into your 60s, 70s, and beyond. These tips may seem simple, even ordinary, but their impact is anything but. First and foremost, hydration is non-negotiable. Dehydration makes everything harder, from circulation to urination to sexual stamina. Drinking enough water each day supports tissue health, keeps the urinary tract functioning properly, and can even help reduce the risk of urinary tract infections, which become more common as we age. Equally important is sleep. Quality sleep is when your body produces testosterone, repairs tissue, and resets your nervous system. Men who consistently get 7 to 8 hours of rest often report better libido, stronger erections, and improved energy levels overall. If your sleep is irregular or interrupted, especially by frequent urination, it may be time to address underlying causes with your doctor. Another key tip is to watch your blood sugar. High blood sugar damages the small blood vessels and nerves in your penis faster than almost anything else. Managing your glucose levels through mindful eating, movement, and regular testing isn't just good for diabetes, It's one of the best things you can do for your sexual health. Regular checkups with a urologist or primary care physician are also essential. Too many men wait until something feels seriously wrong before they speak up. But early screening for prostate health, testosterone levels, or even changes in the skin of the genitals can prevent complications before they start. Prevention is far more powerful than repair. And finally, don't underestimate the power of consistency. These small actions, walking, staying hydrated, maintaining hygiene, doing Kegels, sleeping well, compound over time. You may not notice a dramatic shift in a day or even a week, but over months, these habits create the foundation for strength, vitality, and control. I've seen it happen over and over again. If you've ever thought aging means giving up on your body, let these tips be your proof that the opposite is true. You have more influence over your health than you realize. And now, as we bring it all together, let's revisit why this care matters so deeply, and how a few simple shifts today can shape not only your health, but your confidence, your independence, and your quality of life for years to come. Conclusion. Caring for your penis after 60 isn't about chasing lost youth or trying to be who you were at 25. It's about honoring the body you have now and giving it the support it needs to keep working well, for your comfort, your dignity, and your quality of life. The truth is, most men were never taught how to take care of this part of themselves. We're taught to be silent about it, to only pay attention when something goes wrong, or to feel shame if things start to change with age. But silence does not lead to strength. Action does. You now know that strong blood flow is the foundation of sexual and urinary health, and that simple habits like walking and eating well can directly improve the performance and vitality of your penis. You understand that basic hygiene is not just about being clean, it's about preventing pain, infection, and even serious medical conditions that can creep up unnoticed. You've learned that the pelvic floor is a powerful set of muscles that quietly governs your ability to hold urine, maintain erections, and feel in control of your body, and that it's never too late to strengthen it. And perhaps most importantly, you've been reminded that intimacy is more than performance. Emotional connection, open communication, and redefining what closeness means are all essential to a full and satisfying life after 60. These are not just tips, they're tools. They are ways of showing up for yourself. They are a form of self-respect. When you take care of this part of your health, you're not being vain. You're being proactive. You're investing in a future where you stay engaged, independent, and empowered. And no matter what age you are, that's a future worth building. So let this be your starting point. Let today be the day you stop ignoring and start supporting a part of yourself that deserves attention and care. You've learned the essentials. You've got the daily habits. Now the question becomes, what will you do with them? Your health is still in your hands, your body is still capable, and your best years can still be ahead of you if you choose to show up for them. Because aging isn't about decline, it's about direction, and you still get to choose yours. If this message resonated with you, please take a moment to like this video, share it with a friend who might need it, and leave a comment below, even just a simple, "I'm taking action," to let me know you're ready to invest in your health. Your engagement helps more men find the support they deserve.